Okay, which of the following is the most likely outcome for this pregnancy? Um, okay, just looks like different outcomes. Pregnant woman at 18 weeks gestation undergoes a routine prenatal ultrasound. The ultrasound reveals multiple fetal anomalies, including a strawberry-shaped head, clenched hands with overlapping fingers, and rocker bottom feet. The fetus also has a large VSD. Obstetrician suggests chromosomal analysis, which confirms the presence of an extra chromosome 18. Which of the following is the most likely outcome for this pregnancy? So, as soon as I saw rocker bottom feet, I was thinking of 18, which I believe is um, Edwards syndrome. So, as far as outcome, let's see, fetal demise, mild developmental delays, surgical interventions, normal development, severe intellectual disability, but normal life expectancy. Honestly, so it's knowing kind of what Edwards syndrome can lead to, if it's viable or not. I don't think fetal demise. I feel like you can still live from Edwards, but I'm honestly not completely sure. Let's see. So I mean, if the ultrasound has strawberry shaped head, clench hands, rocker bottom feet, he has a VSD. I mean, all of those things I think are viable, if I didn't know, kind of how to treat someone with Edwards.
Sure. So let me ask you a question here. Let me see if I can
Yeah.
sway you here. Is
Mhm.
Edwards rare?
I think so, yes.
Okay. The more rare something is it usually good or bad? Just think of it like that.
Usually bad.
Yeah. The more rare a diagnosis is, it's usually bad, like pretty bad, right? So, you can start getting rid of things that are mild, if that makes sense.
Hmm. So mild developmental delays, probably. And normal development, you could probably get rid of that. I mean, technically, could you have surgical interventions?
You
But
could, but do you think if you have this is test taking, right? In a sense, right?
yeah.
Multiple surgeries. If you have multiple surgeries, can you have a normal life expectancy? Yeah, in theory, yeah. But those are really like healthy individuals, right? Um, if I were to work through this, right, I would say for one, this kid, even if, let's just say if this kid were to live a long time, they would need a lot of surgery. So that could be an answer. And I would also expect this kid to have severe intellectual disabilities if they live for a long time. But knowing how Edwards is super, super rare, I assume that these kids mostly die. That's in my
Yeah.
mind, right? Does that make sense kind of how you work through that? Because it's so
Yeah.
rare, then you have to assume that these kids, like, to be honest, I've never seen an Edwards kid on my rotations, on my years of residency, right? When we deal with peds, even like complex, syndromic kids, never seen an Edwards. So that means that these kids are probably either dead, like they die in utero or they die in the neonatal period. So that's what I would.
Okay.
Does it make
Yeah.
sense on a
Yeah.
testing standpoint?
Yeah, that
Yeah.
makes sense.
So, right, ultrasound finding 18 or Edwards syndrome, right? So, I'm pretty sure that if you have full Edwards, I think the majority of them, I think up to 80% die in utero, and then, oh no, 50% die in utero, and then most kids live up to, like, they don't live past 1 year of age. So,
Okay.
okay. Th- Questions about that?
I don't think so. I think how you explained it makes a lot of sense, especially with like test taking strategy too.
Yeah. So just kind of, like I said, think in your mind, right? It's just kind of, the more rare something is, I always say it's a safe bet to say it's worse, right? So, this is a little side note, right? in an ENT realm, right? We always learn the prevalences of like certain cancers and things like that. The more prevalent a cancer is usually the less aggressive. The more rare it is, where we don't see it often, you know it's really really bad. So you can apply that to almost everything in medicine for the most part. There's always exceptions, as you already know, but on a testing standpoint, you can kind of use that.